18 minutes past 7 is the time. Good morning to you. Breast cancer, often thought of something that affects women, but it can also be diagnosed in men.
Yes, the fact it's quite rare in males can pose unique challenges for those who learn they have the disease. So let's take you through some of the figures. Around 1 in 7 women in the UK will be diagnosed with breast cancer during their lifetime. Cases are far less common in men, with about 1 in 870 men developing the disease.
So let's put this in context. Each year in the UK, there are around 55,000 cases of breast cancer in females and 370 in males. Now, earlier this year, James Richards was told he had breast cancer. He's 36 years old. He joins us now alongside consultant clinical oncologist Dr. Vivek Mishra. Good morning to you both.
Morning.
James, how are you?
Yeah, I'm doing OK. I think anyone who's been diagnosed with cancer can probably say it's an ongoing journey, but, you know, you sort of make the best of it. I think, you know, for me, there's been a big awareness problem around male breast cancer, which is obviously why I'm here today. And I think what we need to do is we need to challenge the language and iconography around breast cancer to sort of move away from that perception that it's a women's disease.
Women are told to check their breasts regularly. Most women kind of have an idea of how to do it. We try to remember. Men aren't really told to do that. How did you realise that there was a problem? Yeah,
so it was in January this year. I was just at work in a meeting, sort of had my arms crossed and sort of felt something. I think for me, you know, it was January. I've been doing a lot of exercise, trying to shift that holiday weight. You know, I think we've all got that sort of problem. You know, one of my colleagues came up to me, Tony Roebuck, and he told me that I should probably go and get this checked out.
So you'd said to him,
I just mentioned it on the off chance, and he had actually had his own experiences, which was absolutely fine, but, you know, it's better to be safe than sorry. But, you know, I just kind of went back to work, and it was probably about 4 or 5 weeks until I even booked an appointment. And I think, for me, if that awareness was there and I'd sort of known that, you know, I would have gone straight away. And I think that's part of the problem. That's why...
So did you think breast cancer didn't happen to men?
Exactly.
Right, OK.
And, you know, you sort of... You think about pancreatic or prostate or testicular, you don't think about breast cancer, and I think that's the problem.
Doctor, good morning to you. At what point do you meet people who have been diagnosed? Where do you get involved in the process?
So as an oncologist, my job usually starts after the diagnosis. So somebody like James would go to their doctor, they'd be referred to usually a one-stop clinic, and there they meet a surgeon, they have various tests that confirm the presence of cancer. Then we discuss the diagnostic characteristics of the cancer in a meeting called the MDT, and from there, patients are then referred to an oncologist for more treatment.
We're all in favour of talking openly about health conditions here, as I think we're getting better, maybe certainly in the media, maybe amongst ourselves. Tell us a bit more about breast cancer in men. Tell us what it is, what does it look like?
Yeah, so I think, as James has said, one of the big issues is lack of awareness that actually men can also get breast cancers. So men have breast tissue, it's usually behind the nipple. So it's not as extensive as women have. But anything that is abnormal, for example, a lump. Now, the lump need not be painless. It can be painful as well. A change in the skin condition, so a rash that doesn't go away. Sometimes the nipple can look like it's got eczema, and that's something which confuses people, even doctors, quite a lot.
So that would be like a colour, almost like a colouring, or the...
Yeah, the colour, and it looks a bit dry and a bit scaly as well. So if you've ever seen anybody with eczema, it's the same thing, like a dermatitis. So something that doesn't go away, so change in that sort of look and feel of the skin, discharge, especially if it's a blood-stained discharge from the nipple, which is very unusual in men. That certainly should be something to look out for. The other thing is sometimes there can be lymph glands under the arm as well. So the lump might not be felt in the breast tissue, but under the arm. So a lymph gland, feeling something under in the armpit, those are the sort of things that people should report to their doctors.
So it's being aware of your body, basically.
Yes.
Whereas, you know, women are told, do it once a month because typically have monthly cycles, but for men, obviously, that is different. James, you're still undergoing treatment. You've got an operation in about a week, have you?
Yeah, just over a week's time.
What's happening?
So I finished chemotherapy about 6 weeks ago. And so the next stage is it's sort of like a mastectomy. So I think this kind of highlights, for me, why there needs to be more research and funding to male breast cancer. That there's the uncertainty and there's a sort of cookie-cutter template from, well, this is what we do for women, which is understandable. As you've pointed out, there's a low number of instances in men.
55,000 compared to 370. Yeah.
But each one of those is a story in someone's father or, brother or son. But I think there was a week there where, it started off as I was having a single mastectomy and then a double and then back to a single and then sort of none at all. And that's why I've set up Moobs. It's the whole thing about support as well, because cancer can be very isolating as it is. But to be in a place where you feel like there's no kind of tailored support, this is kind of where we want to bring people in all stages of their journeys to have that discussion.
Vivek, would there be reconstructive surgery offered if it was a significant mastectomy? Is it a mini lump?
So
is it a lumpectomy?
It's called a central excision, so it's like a removal of the nipple and a slight more. So it's not as intrusive as a full mastectomy, but, the treatment options are different for everyone.
Yeah, I mean, I think one of the differences between the male chest and a female breast is the amount of tissue that's removed. And one of the differences between surgery is that for men, it's almost always a mastectomy. You rarely can do a lumpectomy because there isn't enough tissue. And because the tumour is almost always behind or very close to the nipple gets taken out. Nipples can be reconstructed, but it still leaves a scar there. Yeah.
James, I know it's something of a cliche about men not talking about their health or not sharing it. I think it was is it Tony who was your mate?
Tony Roebuck, yeah.
OK, you've given him a name check, which is great. But, I mean, there's a truth in it, isn't there? Men tend not to, or they feel something in there. I guarantee when you were describing, like feeling there will be people today doing that because they've just heard you say it. But there is a reluctance still, isn't there? Yeah,
and this is particularly true around male breast cancer. During my journey in terms of setting up Moobs, there was a guy who I just so happened to be connected to through a mutual friend. And I spoke to him and I wanted to get him involved. He wanted to sort of remain anonymous. And he said to me, I've always seen myself as a very sort of masculine guy. And I found this completely emasculating. He was worried about what friends and family will think. And he's only got a few people who actually know this. And he said to me, he's a keen rugby player and he goes and plays rugby. And he's hidden it from his teammates. So when he goes back in the changing room, he hides. And that's a real big problem. And it kind of shows that there's a stigma there that really needs to be challenged.
It's the language as well, isn't it? Breasts or moobs. I know you're using that, but it's like they're not seen as virile or masculine words, are they?
And Breast Cancer Awareness Month is fantastic, and awareness has never been higher, and that's always good. But the imagery is pink. It's one of those things that isn't quite compatible for, that sort of male mindset, as it were.
Or the traditional male
Exactly, the traditional male mindset, and I think that's the problem.
It's very good of you to talk to us today. So, the next surgery is...
about a week and a half.
Well, we wish you well, obviously.
Thank you very much.
Thank you so much. And, Doctor, thank you for your expertise as well. Really interesting.
Thank you very much.
Thank you.
It is it's coming up to 27 minutes past 7. Still to come on the programme. We're going to meet the man behind the Rocket Man. Burnley Taupin talks about his career writing hit songs for Elton John.
Time now to get the news, travel and the weather where you are.
A very good morning. Welcome to BBC London. I'm Thomas McGill. 3 Jewish schools in Barnet have announced they will close today, citing safety concerns. Among them, Menorah High School for Girls in Dollis Hill. The Metropolitan Police have issued a statement saying there is no place for hate crime in London and that they're ready to help anyone who has been affected by prejudice, ignorance or violence. This all comes as the government announced £3 million of extra funding to protect schools, synagogues and other Jewish community buildings. A senior Metropolitan Police officer says there needs to be a reset of the use of stop and search and that it traumatises communities if carried out badly. Officers in a new pilot project are targeting areas where weapons cause the most harm. They've also been given training on how to treat people if they are searched.
Stop and search is there to save lives. But communities tell us not just